Hey Blairsville, it's Sarah here with the Chamber of Commerce, and today we are happy to have joining us Homestead Hospice from here in Blairsville, Georgia. Now they have locations throughout the United States, but here in Blairsville, it's both. They offer both hospice and palliative care, and that's really a distinguishing factor. Rhonda, tell us a little bit about that.
Well, I'll start off with our palliative care because that's a service that we do. We love to give our patients and our community members here. It basically means that if they qualify, and we would take a look at their whole medical history and any kind of terminal diagnosis that they have, but they would receive a nurse practitioner in their home as well as a social worker and a chaplain. So they get touches, and we partner with our physicians in order to give them a really great quality of life. So
Now that's a big distinction for you guys. You're offering both nurse practitioner, you're offering a chaplain, and you also are offering a social worker. So these are things that make you guys very unique as
yes,
an option for care for someone who's facing a difficult season in life.
that's right. And they still want to have an independence, and they still want their physician to kind of have a full care over them. We're just another layer of care in the home, and we can prescribe antibiotics, say in the wintertime, and then follow up with their physicians and let them know, hey, Miss Jones is doing okay. We had to prescribe an antibiotic for a sinus infection, but otherwise we're doing okay. She's due for a visit in the next couple of weeks, and we're going to remind her of it. So that's kind of what we do with palliative.
Okay, and then so heading into hospice care from there, what does that look like?
Hospice care, and this is something that we really try to educate the community on, because oftentimes people, it's gotten a bad rap. People think that it's about giving up hope, but in all actuality, it's not. It's for the patient who does have a terminal diagnosis, and they need another extra layer of care in the home, but they're choosing not to receive or not to pursue any kind of aggressive treatment, which is like COPD, CHF. There's a whole array of diagnoses that can qualify a person, and we provide a nurse that comes to the home, aides depending on their level of care that they need, coming to help with bathing. And a really awesome thing about hospice is that it also it covers everything in regards to their durable medical equipment. So people who need a bed or a commode beside the bed, just to make life a little easier. And then we have, of course, a chaplain and a social worker. And another thing that's so unique about our Homestead's Hospice is we have a volunteer program. And so Shannon heads up our volunteer program here, so they can also help. And I'll let Shannon talk about that.
Yeah, so our volunteer program is, we provide volunteers both in home and in the office to do clerical work, but in home to relieve the caregivers the stress that they're undergoing, so they can have a couple of minutes to take a shower or go to the grocery store or just run some errands and take care of those things, because there are family caregivers that are just completely run down with what they've had to go through.
Yes.
So the volunteers are just a huge factor. And you said something neat to me. You said, was it 10 years ago that you were telling me about your
Yeah, I both my grandparents were on hospice about 10 years ago, and to this day I still remember the name of the volunteer that came out, as I was the primary caregiver for my grandparents. So I know how much it means to have somebody that can be there for you and just give you that little bit of time to have your respite.
Very, very important. And, Rhonda, I was asking you, when does someone seek care? Do you do that when you're 65 and healthy? Do you wait until you're at the very end and the doctor is saying, listen, this is it, a matter of days? When should someone reach out to you guys?
Honestly, the earlier, the better. Our care programs are designed for if you have a terminal illness, whatever it may be, or a chronic illness, which there is a little difference scientifically between those terms, but call us. We can do an evaluation, and we can just see what you're qualified for. But the earlier, the better. the earlier the better. If you have something, and I mentioned these specific cases, COPD, CHF, CAD, even neurological disorders like MS or, Lou Gehrig's, Parkinson's is a big one. Yeah, so any of those, even if you're in beginning stages, our palliative program, it's designed to help make your life easier. And we partner with people who can even help further, not only our volunteers, but comfort keepers who is here, people who can provide home care, our social workers. They can help get people placed in assisted living facilities if that's something that they choose. So there's just so much that we can provide for our seniors, and most of it is paid for. So the cost is, virtually, it's something that they paid for a long time ago.
Yeah, and that's something I've learned is that a lot of times people are not aware that they have coverage for
Yes.
this type of assistance.
Yes, correct.
So most insurance, you take
Yes.
you take all forms of insurance, and tell us about that.
Yes, and I love this. If they are 65 years of age and over, and they have Medicare, Part A and B, for hospice coverage, it's 100% coverage. And that's included everything, diapers, wipes, durable medical equipment, as I mentioned previously. And that's something that their taxes pays for. So, it's an incredible benefit. And of course, the VA, we are preferred vendors from the VA. So we work with the VA recipients very, very well. So,
Okay.
and then of course for palliative, that is a Medicare Part B. And sometimes there's a copay, but we just have to, run that. But they know before they choose to sign up for the program. So everything is very transparent. And it's just a phenomenal service.
So significant for people that are facing just big challenges, and having this type of resource
Yes.
is just like having someone literally hold your hand through one of the most challenging spaces in
so.
life.
Absolutely.
I think that's a good way.
Yeah.
We're a family at our office, and we treat everybody that we take care of like family. So that's kind of how it works. Make
Mhm.
sure we're there for them through
Yeah.
those tough times.
That's so true.
Where are you located in Blairsville?
We are at 168 Rogers Street, and
Okay.
it's the old Department of Labor building, if everybody knows where that is. We're
Yep.
upstairs, so we're just kind of off the square, but a little bit hidden.
Okay, very good. So off the square, but up the stairs in the old
Mhm.
Rogers building. And I think you said it well when you said you treat everyone like family. So if you have family needing care, this is where you want to go so that they're going to treat them just like you would. And just thank you, ladies, so much for joining us this morning.
Thank you.
you.
Thanks for having us.